Madam Speaker, the wait time for elective echocardiograms, important for imaging the heart, has ballooned to 70 weeks at St. Boniface Hospital and 63 weeks at the Health Sciences Centre. In contrast, at Regina's Advanced Echo Lab, a patient can get a provincially funded echocardiogram within 1 week. Ontario cardiologist and Vice Dean of Medicine at Queen's University, Dr. Chris Simpson, says, "I don't know of anywhere else that has this sustained problem with this degree of magnitude in echocardiography access. Why has the Minister of Health so poorly managed healthcare in Manitoba that the wait time for an echocardiogram is more than 60 times longer in Manitoba than in Saskatchewan?"
Whoa. The Honourable Minister of Health, Seniors and Active Living.
Madam Speaker, the member for River Heights should have done a little more research, because what it would have showed him is where those gains have been made in places like Saskatchewan and Ontario, it is because the system has been able to, in some cases, procure those tests from private sources on the outside. That member's own federal government prohibits that, and as a matter of fact, is enforcing these rules very vigorously in places like Saskatchewan and Ontario. If that member wants to see the kind of change, perhaps he should pick up the phone and dial 1-800-JUSTIN and have a conversation about how to build a better, more rigorous, more robust healthcare system across Canada.
The Honourable Member for River Heights on a supplementary question.
Yeah, Madam Speaker, sad the Minister doesn't know how to get results. Most governments, when elected, have a plan for action for the first 100 days. This government has had more than 1,000 days in office, and the wait times for echocardiograms and ultrasounds are much worse instead of better. The mean wait for an ultrasound in Winnipeg is 16 weeks, while in Saskatoon an ultrasound can be done within a week. Ultrasound waits in Manitoba are only 16 times as long as those in Saskatchewan. The minister should be embarrassed that he can do no better than this in more than 1,000 days. Will the minister please stand up and apologize to Manitobans for the mess his government has made in healthcare?
The Honourable Minister of Health, Seniors and Active Living.
I'm pleased to give the report and indicate that in the last 8 weeks, 7 new echosonographers were hired to fill vacancies. This investment will add 7,000 echocardiogram tests to the system within 1 year. We've increased the number of these tests by 19% over what the NDP ever did in this province since 2016, and we believe that these measures will be effective. On the issue of private procurement, we've asked our officials to also look out. We're not ideological. We're looking for solutions to get better health care in Manitoba. If that member really wanted to see the change, he would talk to his federal cousins about giving a more significant and sustainable health care investment in Manitoba from the federal government going forward.
The Honourable Member for River Heights on a final supplementary.
Madam Speaker, if this government were to continue in office in another 1,000 days, we'd still have long wait times. But it's not just wait times. With surgery at Victoria and Concordia hospitals now, if a significant problem arises during surgery, there is not the ICU capacity at these hospitals. Instead, patients have to be transferred to ICUs at the Health Sciences Centre or St. Boniface. But if these are already full, there is a problem, and such problems are now occurring. What is the minister's backup plan when ICUs at St. Boniface and Health Sciences Centre and the Grace are full?
The Honourable Minister of Health, Seniors and Active Living.
I thank the member for River Heights for actually making our point about the need for healthcare transformation to better co-locate resources within the system, not in silos as was done under the NDP, but meaningfully and coherently making services in places that will be robust enough to serve the public. That is exactly our plan. That is exactly the path forward. The NDP's history was marred by transfers between hospitals that were leading the nation. We need to drive down the number of transfers inter-facilities and be able to get better results for Manitobans, and that is exactly our plan.